a proper medical scientist in the room, and we are following the science. For me personally, I did lose my sense of taste, and that actually is it's come back though. I can assure people who have lost their sense of taste that the good news is that in my case wasn't permanent. I just on the first point about the clinical trials, the answer is that we are looking for people to sign up to the clinical trials where that's possible within that hospital and where that is clinically advised. This is the call really is to the NHS, who are the ones who would make recommendations that somebody would be on a clinical trial. JVT, do you want to add to those two questions and also answer Robert's middle question on the rate of infection?
Yes, thank you very much. I will answer those questions. On the point about loss of taste and smell, anosmia, we have actually asked our expert advisory committee, NervTag, to look at this, and there are some anecdotal data that are now in the published domain that suggest that a proportion of people do indeed lose their sense of taste and smell. However, we have looked at the data that there are in relation to whether that on its own is a symptom that would be important to add to the case definition, and the answer to that from our experts is absolutely not. That yes, this is true, or as far as we can tell on limited data, it appears to be true, but it doesn't contribute anything on its own to the overall affinity of the diagnosis. On the second point about volunteers for clinical trials, people will have read in the newspapers sometimes when a new drug is being tried that there's an advert and you ring up and you volunteer for the clinical trial. This is a very different scenario. Here, these are about patients who are undergoing treatment at some stage for COVID-19. First of all, we need the physicians in charge of their care to sign up for the clinical trial. And then it is up to the physicians to approach the patient and ask them if they would like to take part. And it's a process of very careful, written, informed consent for that to happen. But the straight answer is yes, we do need people to take part in the clinical trials, and they are doing. For the recovery trial, yesterday's figure reported to me was a little over 700 patients into the trial. Today, I'm walking on my way to 10 Downing Street, and the number comes through of 926. This is really fantastic work by both